Welcome, everyone. Good afternoon, Yate. Welcome and thank you for joining our webinar today. We're so excited to have you all here on this fine Thursday. My name is Donald Chi. I am Dinev from the Navajo Nation. Tachi Ninchlindo, Ashin Bashichin, Kilichi Indashachedo, Taba Dashanale. I'm originally from Red Valley, Arizona, but I currently live in Albuquerque, New Mexico. I'm the program coordinator for the National Native HIV Network. We're under the Community Health Education and Resiliency Program here at the Albuquerque Area Indian Health Board. On behalf of the National Native HIV Network, we welcome you to today's webinar. Today's webinar is titled Building Bridges, Housing, Healthcare, and Hope for People Living with HIV and AIDS. Before we begin, I want to give a brief overview of the National Native HIV Network, and then after that, I'll go over some housekeeping announcements. So the network was created in 2017. It's a community-led response to increase and organize a national voice and presence in the HIV movement from the American Indian, Alaska Native, and Native Hawaiian communities, with support from the Indian Health Service and the Health and Human Services Office of the Secretary Minority HIV/AIDS Fund. The network provides input and guidance to assist IHS and other agencies in efforts to reach high-risk American Indian, Alaska Native, and Native Hawaiian populations with HIV testing, prevention, and treatment. The network builds group capacity and provides assistance to support extensive community engagement strategies, dissemination of information at regional and national levels, and supports professional and leadership development to sustain these efforts. Our comprehensive approach is always rooted in our cultural values, teachings, and affection to our communities. So these webinars that we host are every other month, and it's one of the efforts or one of the initiatives under the network. We cover various HIV-related topics, like today's webinar, HIV and housing. So the next one will be in July, and that will be on HIV testing kits, the campaigns that are going on in tribal communities and across the nation. So before we move on, we have some housekeeping announcements. This webinar will be recorded so we can make it available to others who could not attend today. They'll be available on our YouTube channel and also on our National Native HIV Network website. For questions, please drop those in the chat box, and we'll hold off to answer those questions at the end of both presentations. So today we have two wonderful speakers coming to us from Nevada. Juana Grant will be our first presenter. She is the Director of Education and Outreach at the Nevada Housing Coalition. Her organization works on a statewide capacity building project to promote and advance affordable housing across Nevada. Juana recently returned to her hometown of Las Vegas after 10 years in the Pacific Northwest working in supportive housing, harm reduction, and diversion programs. She has significant experience providing direct services to chronically unhoused individuals from the streets to transitional, supportive, and independent housing. This path has fostered an impassioned commitment to the affordable housing movement and housing first models in particular. In addition to social services, she has built a range of skills in writing and communication support, event planning, and education and outreach for a variety of community-oriented and public health programs. She believes in fostering a culture of support, resource sharing, and collaboration among organizations, and is excited by the opportunity to do just that in her role at Nevada Housing Coalition. Joanna has a BA, a Bachelor's of Arts degree in Cultural Studies from the University of Nevada, Las Vegas, and a Master's of Arts degree in Interdisciplinary Graduate Studies from the University of British Columbia, Okanagan. She started her career in nonprofits at Jean Ndetch Women's Center at UNLV and is thrilled to be back home in Las Vegas, making herself useful to the community that raised her. Thank you so much, Joanna, for providing a presentation today. After your presentation, I'll introduce our other presenter, Darnell Dewaney, with the Golden Rainbow Program in Las Vegas, Nevada. Okay, Joanna, take it away.
Thank you so much, Don. So it's always so interesting and embarrassing to hear someone read your bio. I'm just like, oh. So funny. I'll go ahead and share my screen. Hello, everybody. Can you guys see that? All right, I think it's working. Okay. As Don mentioned, my name is Joanna Grant, and I am the Director of Education and Outreach for the Nevada Housing Coalition. We are a 501c3 nonprofit here in Nevada doing advocacy and education and collaboration work to advance affordable housing in the state. I put a little bio in here, but you just heard even more in depth about my background. But just a little bit about the connection to this topic is that my very first job in social services was actually an AIDS service organization. And so I really have a strong passion for the public health and this kind of work that you're doing. Before I moved into homeless services, and now in this position, which is very different from my background in social work. So I'm really happy to be here today and really be digging into those intersections between the work that you all are doing and the work that I have been doing and I'm now doing. That long thread. As I mentioned, Nevada Housing Coalition is a 501c3 member-based nonprofit. We promote the development and preservation of affordable housing. We're really focused on that development side and preservation side versus providing direct services. We really, our members are made up of a kind of wide range of affordable housing stakeholders, from community organizations and service providers like you all, and also developers, finance, public jurisdictions, municipalities, anyone who's engaged in the affordable housing space at any level, particularly around building. So we work primarily to develop and advocate for policy changes in the legislative session, and to increase resources and streamline efficiencies for affordable housing development in Nevada across the state. As Director of Education and Outreach, I'm really tasked with these collaborative efforts and education efforts around talking about different affordable housing interventions, supportive housing in particular, working with our tribes on affordable housing development that's unique to work building on tribal land, and our cross-sector collaboration groups, roundtables, networking. We have an annual conference every year, a statewide housing conference every year, and we provide a lot of education and training and networking opportunities there for stakeholders that are working in Nevada. Our last legislative session, we passed 4 bills. I won't go into detail about these bills. They're really specific to Nevada, but one that I was really excited about is AB 310, that first one there. And that is the first time we've ever created a definition for supportive housing in legislature in Nevada. We don't have nearly enough supportive housing in general, but we also don't have very much purpose-built supportive housing in Nevada. So we're really working on increasing resources and infrastructure to build purpose-built supportive housing here in Nevada. So that was a very big deal for us, that AB 310, and it's rolling out now in the hands of our Housing Finance Agency. So I'll just talk a little bit about how we work, the definitions that we kind of work around with housing affordability. The coalition really works to advance affordable housing across the spectrum. We don't just work in the homelessness space or in the subsidized housing space, but we really try to work at advancing housing across the spectrum. So a lot of our work really sits in that community housing and affordable rental area, where we're working with developers who do multifamily apartment buildings that are subsidized for people who are living at or below 60% of the area median income in Nevada. But we really are working to build along that spectrum. So we define, and the HUD, not just us, but the mainstream definition for affordable housing is that anyone who is not paying more than 30% of their income for gross housing costs, so mainly rent and utilities, that means your housing is affordable. So even if you're living in market rate rent, if your housing costs are below 30% of what you're making a year, then your housing would be considered affordable. Many people, of course, think of different things when they think of affordable housing, and they think of subsidized housing or Section 8 housing. But we're really working across a broad definition, and we kind of stay in or move and do policy in many different spaces, and especially trying to get at our greatest gaps here in Nevada, which I'll talk about. Our affordable housing supply here in Nevada is very low compared to other places. Our affordable housing field is pretty new, actually. We're a young state, and our affordable housing industry is even younger. We only have 36,000 subsidized units here in Nevada, and we have only 1,100 of those units will really serve populations making below 30% of the area median income. So I imagine that is a lot of the folks that that are receiving services from social work. But in Nevada, also our wages are quite low, so that's also a majority of our workforce is sitting at 30% of AMI, even if they don't need the kind of services, because they might not have other barriers besides the income level. They still can't afford housing on their own. So we're really struggling with inventory here. We have the lowest inventory in the nation, actually, for housing for folks that are living below 30% of the area median income, according to the National Low Income Housing Coalition. So there's been a lot of momentum here in Nevada, but we still are quite far away. We only have 14 units per 100 individuals who need housing, who are living at or below that 30% area median income. So that is quite low, and it's a real inventory shortage here. You can see that 93% of our folks at that 30% range are also cost burdened. So those folks who do have homes but are living with low wages are most of those folks are really struggling to pay their rent every month and are really just one paycheck away from being homeless or losing their housing. And so it's estimated that we need 80,000 units. That's, again, just for that extremely low income bracket of income level. We actually probably need around 200,000 affordable housing units or subsidized units to really close the gaps on our inventory across all income levels. And the wages piece is key here. So housing costs have gone up, and this is across the nation. Nevada is not unique in some of these struggles, but the cost of our housing has gone up about 240% in the last 10 years, and wages in Nevada have only gone up 30% in that same amount of time. So our working folks are really struggling to afford homes for themselves and their families. As you can see from this graph here, a family who needs to afford a 2-bedroom apartment, maybe says it needs to make at least almost needs to make $58,000 per year. But as you can see, our wages there with social workers, elementary teachers, waiters and waitresses, these are some of our most popular jobs in Nevada, the jobs that we have the most of. These are the wages for those jobs. So social workers are really only making about an average of $53,000. So if they need a 2-bedroom apartment, they're really not quite making enough even to rent a 2-bedroom. And it's even starker for home ownership. We have a real inventory gap for starter homes or affordable homes for first-time home buyers. So as you can see, again, that it's estimated that you need $150,000 to make a 3% down payment. You need to make $150,000 a year. And as you can see, most of the jobs that we have the most of here in Nevada don't even come close to paying $142,000 a year. So there's a real gap between what is needed to have that affordable home ownership, paying no more than 30% of your income, and what our wages are averaging out for a lot of our jobs. But what I do, I was hired 2 years ago at the coalition after moving back to Las Vegas to coordinate a statewide capacity building program to really build up the affordable housing industry, to bring cross-sector collaboration, to foster cross-sector collaboration, and to really try and get some projects into the pipeline and across the finish line that are really targeting those greatest gaps. So some of our greatest gaps, as you saw, is definitely housing for very extremely low income populations. That includes supportive housing. So that's one of my major projects, and we're going to talk a little bit more about that today. I also work closely in tribal and rural areas because those are some of our other gaps in resources, is housing to advance housing for tribal communities out in the reservations, and then also rural projects. It's hard here in Nevada because we're a low population state. We really only have 2 major metropolitan areas. So the rural communities are really resource strapped in getting the housing that they need, and they have unique barriers, just like the tribes, to building the kind of housing that their communities need. So it doesn't work to do a one size fits all approach. So I'm really trying to target it in that way. And then we also have fewer nonprofit developers here in the state, and we're really trying to foster some emerging developers and get new folks into the field to build affordable housing. It's quite complicated, as I have learned. I have a case manager background, so I had no idea how to develop housing until I got this job. So that's really what I've been working on, is creating education opportunities like this, going out in the community and kind of building a shared understanding of the affordable housing needs in Nevada, and really fostering the coalition in general so that we can do some policy work during our legislative session. So capacity, this is kind of just the theory of change that I use. I'm really trying to build that shared understanding, share different best practices from other states, and policy solutions, and really get a cross-sector commitment so that we have more streamlined and consistent practice, especially around some of our evidence-based interventions like supportive housing. And then one piece of that puzzle is also capacity building for tribal housing. I mentioned it briefly, but recently we received a grant from the Federal Home Loan Bank, who is the seed funder for Elevate Nevada, our capacity building program, to work specifically with tribes on capacity building. So I have been meeting regularly with our tribal housing directors up in Northern Nevada. There's about 8 tribes that meet regularly who are housing directors for their communities. And we talk about different resource gaps and share practices. And I try to bring resources and legislators and relationship building opportunities to those meetings. And because of that success of that work, the Federal Home Loan Bank has invested even more money into doing that. We're going to be providing some technical assistance, education, and training for tribes in Nevada to advance affordable housing. There's been a lot of really wonderful momentum in tribal housing in Nevada in the last 2 years. We recently got some set-asides in our fund and some of our funding resources through the state to build specifically on tribal land. So that's really exciting. And we've been collaborating regularly with other tribal organizations, the Nevada, California Indian Housing Association, and California Rural Housing Coalition, and Arizona Housing Coalition. We're all working on this regional project together because, as many of you know, tribes often cross state borders. And so we really have to find a way to accommodate and support across borders, because each state has a different regulations, different resources, different relationships with their tribes. So that's why it's really exciting work that we're doing. And this has really just started. I've been working with the tribes for 2 years on outreach and inviting them into coalition work, but this tribal specific funding and these programming that we're doing is quite new. Just this year, we've gotten this grant. So it's very, very exciting. I put some contact information for my partners in California and Arizona, because I know we have attendees from all across the states here today. So if any of you are interested in learning more, I think these slides are being sent out, and that contact is in that information if you're in those states. Why is this? Here we go. So some of the ways I am working with the tribes, it really started with outreach. When I started at the coalition 2 years ago, that was one of the priorities of the Federal Home Loan Bank, was to help them access some of their affordable housing development programs. And so really, I just started showing up at tribal housing events through Nevada, California Indian Housing Association, and I met some folks that way. And I went to some conferences, some national conferences, to learn what other communities were doing. And then I started inviting the tribes actually just to participate in coalition events that are presenting at our conference, presenting at our lunch and learns, and those kinds of things. So really, I try really hard to be reliable when I'm working with anybody. Actually, these are kind of my outreach practices in general, but they also work depending on tribal populations, or they also work to foster relationships in all populations. So I really try to provide a platform for them and speak alongside. One of the things that is important to consider in the work that I do, or the coalition does, is that when we're doing policy work, it's really important to consider the unique needs of tribal communities and their sovereignty, and making sure that the policies that we're creating and the new resources are accessible to them, and also don't impede the work that they're also doing, because the tribes are also working on their own policies and improving their own housing resources by advocating with HUD or at the state legislative level. So it's important for us to maintain relationships and work together, even though they have really unique barriers to developing on that land. So they don't necessarily benefit from all the work that we do across the board. So creating that work alongside them, asking them exactly what they need, and then going out and getting the resources and do it has really been a successful approach for me to working with our tribal communities. We developed the education and TA program together. I took the opportunity for this funding to them to one of our meetings, and we sat down and wrote down all the education and training opportunities that they were hoping for that they thought would improve. And that's really, I really just go to them and ask them what they want, and then I come back and start working on it. So it's been a really, really good and successful program so far. I'm really excited about the work that we do. And there are some unique considerations for development for tribes. So we also work with some national partners to do the trainings, and some folks that have the expertise on for development in tribal land. So some of the conversations that we have around sovereignty, so a lot of state governments will ask tribes to waive their sovereignty so that they can access resources, which can be a very difficult thing for tribes to do. It can cause problems in other bureaucratic ways. And so we have a lot of conversations right now in Nevada around finding another way, an alternative to the limited waiver of sovereignty, to make sure that we can serve our tribes without creating undue hardship in those ways. Often our tribes here in Nevada are also in rural areas. We do have some tribes here in Southern Nevada. I'm based in Las Vegas, but the work that we're doing is really targeting developing housing on tribal land. And so sometimes there's real infrastructure issues there. It takes longer to build because there might not be power lines or water or things like that. So there's a lot of unique considerations, which is why we do unique programming that's specific to tribal development, in addition to the broader programming that we do. These are just some of the partners and resources that I use. Corporation for Supportive Housing, Enterprise Community Partners has a rural and tribal department, and we're working with them. Nevada has a specific TA provider called RCAC. I forgot to put them on here, but that's who we're partnering with on this program specifically. And then there's financing for tribes specifically through all of these agencies. And these are all specific to affordable housing development. There's a lot of tribes through HUD and the Office of Native American Programs and the USDA that are really specific to tribal housing and building on tribal land. But they're in Nevada, it's less well known, are available funding through the state and through municipalities that tribes could access, but they don't necessarily know. So we're working on finding a way to create some resource guides so that they can access more of these funding that they're technically eligible for, but that aren't specific to tribes. And the Federal Home Loan Banks, especially Federal Home Loan Bank San Francisco, is really working hard to develop tribal-specific affordable housing programs, and that is our main partner on a lot of these initiatives. And so if you're in California, Arizona, they can be a great resource for your programs. They have the AHEAD grant and the AHP program, which is Affordable Housing Gap Financing. But the AHEAD program is a great grant. It's $100,000. It's quite low compliance, and it's available for it's pretty flexible. So you can use it at your organizations for capacity building, for tribal outreach, for economic development, even for direct services. So definitely something to look into. So some of you, I know you're mostly healthcare providers, so you're like, we don't do development. So I know some of this might not be directly related to the work that you're doing, but I think you all know, we can all say that housing is healthcare. One of the things I learned through my partnership with Arizona Housing Coalition is about this social determinants of health guide that's specific for tribal leadership. This is just one page of that guide that I picked out around housing, and this was created in partnership by the Intertribal Council of Arizona and Vitalist Health, and they created elements of a healthy tribal community wheel. It's very interesting, and I find it really useful, so I put it in here to really draw out that intersection between housing and healthcare being really key. I'm sorry, I was not tracking my time. Am I at 20 minutes? Good. Am I good? Okay. I'll just run through that. Darnell's going to talk a little bit more about supportive housing in a direct way, because that's the work that he's doing. But I have a background as a case manager in supportive housing, and so I really believe in it. It's like my #1 top passion. This is a photograph of one of my very first clients in supportive housing, Jeannie Gay. She changed my life. I got a job at an organization called Plymouth Housing in Seattle, and it was my first time learning about supportive housing and harm reduction and housing first principles. And it's really driven my career since then. And Jeannie lived on the streets for many, many years before she was able to get an apartment in the Humphrey House, where I also got a job. She really struggled with alcoholism. She had a significant amount of trauma as a child, and she was disabled. She was hit by a bus in downtown Seattle, and that's how she ended up getting into housing through medical respite. She was no longer safe for her to live outside when she was using a walker. And she really taught me how powerful and transformative having housing can be for folks, and the value of folks getting into housing before they are required to participate in other types of programs, the Housing First model. And so I always have a picture of her, and I leave that memorial flyer in there because I just think the case manager who was working with her when she passed away a few years ago, she was in Humphrey House for 10 years before she passed away, but really, I feel like you can really tell how beloved she was in the community, despite having some behavioral health problems, despite struggling with alcohol for the rest of the time she was living there. But she was a really valued member of the community, and the case manager, I was able to go to her memorial because we were all still connected with through Jeannie, because she was such a beloved member of the community. So I just think it is a really lovely story about the value and importance of housing first and supportive housing, and how we build relationships with our clients. But in addition to that, and I think, some of you may already know that supportive housing is evidence-based. So it really is, I believe it's the solution to end chronic homelessness, and it decreases interactions with the criminal justice system and increases positive health outcomes. So as you know, for many of you working, it's hard to go to the doctor if you're living outside, and it's hard to keep your medications on you if you're living outside. So if you have a diagnosis like HIV and you have to take medicine every day, housing becomes paramount to having positive health outcomes. So that's why I'm really a big believer in this model, and some of these principles that go into this model. And then the business case we talk about a lot at the coalition, because as I mentioned, I mostly work with the people who are building the housing, not as much with the folks. I don't do any direct services, but UMC is our hospital, CCDC is our jail here in Las Vegas. So 8 days at the hospital cost the exact same as 3 months at our jail, and that costs the same of 1 year of keeping someone housed. So very, very powerful business case, and that's why we're working very hard here in Nevada to get more supportive housing built. This is just a little bit more information about AB 310, and that development fund for folks that are doing housing here. And these are just some examples I put in of Native American focused supportive housing. So these are 2 projects. This one is in Phoenix. Native American Connections has 5 projects total, and they are an organization dedicated to serving tribal populations, Native populations. And Chief Seattle Club is just an example of tribal specific housing in Seattle. So, and the reason I put this in here, one, is because I know a lot of you folks are working with tribal populations, but also because a lot of the work that I do and my relationship with Darnell actually is kind of fostered by a desire on my part for nonprofits who are serving populations to actually be the housing organizations. So instead of relying on kind of the private market or landlords that maybe don't understand our populations, especially those with behavioral health, substance use, I'm talking about our really vulnerable populations who really need supportive housing. What I've seen work best actually is the experts who are serving that population end up becoming developers and build that housing themselves, because property managers have a vested interest, right, in their properties. But if you're doing a housing first model and you're serving really vulnerable populations, your number one goal is to keep people housed. And so if you're also doing the property management, you can easily blend that mission-driven drive to keep people housed into your property management model as well. And so if there is a lease violation or a behavioral health problem, or if someone is still struggling with drug addiction, you don't kick them out or evict them at the first sign of trouble. So that is why I put these examples in here, is because Chief Seattle Club was actually just a homeless service provider in downtown Seattle for many years that specialized in Native populations. And in 2022, they finally made their dreams come true and became a developer, and they have their very first project in downtown Seattle. And they serve 80% of the folks that live in those permanent supportive housing units are tribal Native folks. And then Native American Connections is a really amazing organization. I brought them here for our Nevada Housing Conference last year. And they have purpose-built supportive housing. They also do a lot of healthcare on site, and they offer culturally specific healthcare for their Native populations, as well as other healthcare services as well. So really amazing. If any of you are in Washington or in Arizona, you can check those out if you're interested more in learning more about supportive housing. If you Want to do that. And this is just, my required plug for if any of you are based in Nevada and would like to join the coalition. Our housing conference is in October this year in Sparks, Nevada. We alternate each year between Las Vegas and Reno. And we have lunch and learns just like this one every month. Ours was yesterday, and it was also on supportive housing. Although we do a wide range of topics, and our legislators really attend a lot of our lunch and learns and to stay informed on affordable housing topics. So it can be a great place to learn about different things that's going on in Nevada. We have the usual social medias, and we also have our Nevada Affordable Housing 101 guide, and we're producing a developer toolkit right now so we can start supporting kind of that building that shared understanding of the complexity of development. So thank you so much. And I'll turn it back over to Don. I really appreciate the time spent today.
Thank you so much, Joanna, for all of that wonderful information. I'll drop your email in the chat. So if folks have any questions or any resources that they may need more info on, they can reach out to you. Okay, our next presenter is Darnell Duaney. Darnell is born and raised in Las Vegas. I'm sorry, living in Southern Nevada as the client programs manager at Golden Rainbow. Darnell is an enrolled member of the Navajo Nation and is the Southwest Regional Manager at Golden Rainbow. Darnell is, wait, I'm sorry, hold on, give me a second. Darnell also facilitates 2 courses with the National Minority AIDS Council that builds the capacity of industry-leading providers, professionals, people living with HIV, and addressing HIV-related stigma. Darnell's background and experience comes from the hospitality industry, specializing in hairdressing. He's kept that momentum by teaching and facilitating professional hairdressers as a national artist within a global company of L'Oreal. Darnell's scope of work involves facilitating health education courses and programs, providing housing stability, acquiring housing for those who are unhoused, overseeing all our housing programs, and providing permanent supportive housing. Darnell has been in his role for about 5 years and will keep going. Darnell applies these learned skills to meet provider and community members' needs. Hospitality comes in many different forms, and this calling to serve keeps Darnell motivated to do more. Thank you, Darnell, for joining us today and for your presentation. And I'll hand it over to you.
Absolutely. Thank you for the introduction. Just like Joanna mentioned, it's a little, embarrassing to hear things about you when someone says some kind things. So thank you for that. I'm going to share my screen right now. All right, so we are pretty much going to be talking about just HIV and housing, and I'm not one to read from slides. I think that's very boring. So, a lot of the content to be delivered is going to be through just, me explaining just, these slides and really kind of going in depth. NNHN, the National Native HIV Network, I am the Southeast Regional Representative. We came together and we're thinking about, just some areas of need. And one of them that was needed was housing. And so, we wanted to create a webinar about housing and what that looks like in the frame and context of 2024. A lot of efforts are being made right now nationally with housing insecurities. And so this is very, very important to us. So again, like Joanna said, she reaches on a statewide level while I'm reaching at a local level, working with all of our other community partners and other non-traditional partnerships. Background is my hairdressing, and which ways have helped me in my career as it is client focused. The only way I can get a client return to my chair is if I do the service correctly and if I'm responding promptly. And again, I have to show up, so all those things have really kind of helped me be a better provider within this new career of mine. Within this presentation, we're going to be really snorkeling with the information. If you would like to scuba dive in the information, I'm more than welcome to provide you my contact information at the end so we can get your questions answered, or I could provide you some more support. But let's get started. So this is just a brief overview of what we're going to kind of cover over. We only have about 30 minutes, so it's not a lot of time. As I mentioned, we're basically going to be just, snorkeling about the information and about, just the services that Golden Rainbow provides and how much movement we've actually, how much movement we were doing. So with the overview, we're going to talk about permanent supportive housing, evidence-based intervention, as Joanna mentioned. We're going to talk about some of the HUD HOPWA programs because there are a lot of HUD HOPWA programs out there. We only just do a little bit of that, but we'll dive a little deeper into that. Who we are, who Golden Rainbow is, and our mission and what we've done over the years, data and programs, as well as any final takeaways and resources for you to utilize within your areas. So a permanent supportive housing, stable housing is a social determinant of health. Housing is healthcare. And from the previous presentation, you can see the heavy impact it has on the individual and the household, but also, the communities and the institutions. You saw that graph with the UMC medical visit, the jail, and then also the 1 year of supportive housing. All of those equally equal the amount of money it takes to put somebody up or to provide a 1 year support of permanent supportive housing. So as Joanna mentioned, the income needed to rent a place isn't achievable, or it closes the gap very, very close. As you saw that 2-bedroom apartment with the amount of income that's needed, that's very, very true. And it really just takes only 1 week of work, one paycheck away, a simple emergency room visit, or even just a life event, someone passed away in the family, just anything in general, especially with here in Las Vegas. The utilities can get high in the summer just because it's very, very hot. And so, just with that little offset of those expenses can put someone into a situation where they could either have a disconnection on their utilities and or be at risk of eviction. So, with the benefits of stable housing, we see that, we get a lot of adherence or a lot of support that clients are taking their medication. Again, you can't really take your medication or hold your medication if you don't have a place to store them. We've seen, longer lifespans for others who have stable housing, less visits to the emergency rooms or any type of hospitals. And then lower transmission rates, and in the HIV epidemic, we're really trying to lower the transmission rates, get people on antiretroviral therapy so they can be undetectable and not transmit the virus. So there's a lot of moving parts going into this, and housing is just that benefit to it. And then just a definition of permanent housing. Permanent housing in which supports, assistance, and supportive services are provided to assist households achieving housing stability. So not only providing a place or a roof over their head, but also providing those support services to address those goals and needs and desires that the client needs, because we don't know where the clients are at. We really don't. And it's really important we got to really dig deep to find out, what that permanent supportive housing looks like for that specific individual. Again, this permanent supportive housing is really client and tenant centered. And again, it's a federally recognized evidence-based practice. So it does work. It really, really does work. So we do have a couple of HUD HOPWA funded programs. HUD is a very, very big system, housing urban development. And within that program, I do like to preface as, there's a lot of demographics, there's a lot of compliance, and there's a lot of reporting. So not every program can really, dive into this without the full capacity and knowing the understanding of your contracts, and also knowing, what is needed to provide this type of assistance in your areas. So and you guys can definitely reach out to me because there's a lot of guidance given, but there's a lot of support as well if you want to have a HUD HOPWA funded program in your area. So the eligibility criteria for HOPWA and for HUD, especially for HOPWA is underneath the HUD category, a subservice of housing. And with HOPWA, they want to create the least amount of barriers to access housing services. And what that means is, they want to make sure that, we're able to house the individual without all of these hoops and turns and, all of these channels to go through. And so I just kind of put up here just the eligibility criteria that we use, as well as our City of Las Vegas, our grantee uses as well. And basically the first, it's pretty much three things, to be honest. Proof of diagnosis, which is inevitable. Housing opportunity for persons with AIDS. They must have an HIV and AIDS diagnosis. And not only that, that one person can qualify for the household. And that kind of brings me to that fourth bullet point. HOPWA recognizes the households, not just individuals. So let's say if you have a family of four, let's say the wife has the HIV diagnosis, she can qualify. She qualifies for the whole household. So everybody that's underneath her beneficiaries would qualify under the HOPWA program. Whereas the Ryan White program, it's only individual to the person that has the diagnosis. Unless you are married or a domestic partnership, that's a little different, but we're just talking about this in general. So you must have a proof of diagnosis. You have to be under 80% area median income. This does change every year, year to year, just like the Ryan White program with the federal poverty level under 400%. That does go up every year just because of living wages and costs. You must be a resident within your county or city. That's very, very important, just like the Ryan White program. So it mimics just a little bit of the same, but that's pretty much the three requirements for anybody receiving a HOPWA assistance. They don't have to, enter in a specific program. They don't have to fill out a specific enrollment form. These are just the three things you will need to access any HOPWA service. And so that's what I was saying. HOPWA wants to, make sure clients receive services or access services within the least amount of barriers. But this also does not include the grantee. The grantee can put different restrictions. They can put additional conditions and limits to their grant if they need to. So to their grant. So it just depends. But within our city, they try to limit it as little as possible for assistance. So to expand on the HOPWA HUD housing programs, these are some of the programs that HOPWA has right now currently. Again, your grantee may opt in for others or not, but these are just the main ones we have on the screen. So STRUMU, that is a lot of this will be a lot of acronyms. I do apologize. I will spell out the acronyms for you because they can get a little confusing. So STRUMU, short-term rent mortgage utility assistance, pretty much rental mortgage utility assistance. Transitional housing, which is pretty much your hotel motel or someone that's transitioning into permanent housing. And that's pretty much, temporary stay. We have tenant-based rental assistance. We have project-based rental assistance, master leasing, permanent housing placement, and then capital development, which is pretty much, any construction or any type of work on your properties. Along with that, HOPWA recognizes that housing is not just the end-all be-all. They do have a ton of support services that organizations can opt in to support the client's housing. And that would be a mental health specialist, nutritional services, and the list goes on. We in our organization only utilize about 2 of these, which would be just transportation and then legal documentation. We know that if you cannot identify yourself or have legal documentation, you cannot apply for any services. And that's for applying for an apartment, applying for any federal programs, sometimes applying or trying to get services from another organization. With their demographics and their reporting, they're going to want some sort of legal documentation to prove who you are. So we cover those at any given time and as many frequencies as possible, because we do understand that most of our people that we work with are either low income or no income at all. So they are unhoused and they may lose or they may get their ID stolen or documents may get lost in the shuffle. So we're always able to provide that assistance at any given time. So who is Golden Rainbow? Golden Rainbow is, we've been around since 1987. Our mission pretty much is to, work with those and get those that are unhoused housed. And, this happened during the height of the AIDS epidemic where, we had a community member die within their garage because of stigma and fear. And so with that mission, we saw a problem and need. And so we created an annual gala called Golden Rainbow. It is now called Ribbon of Life. And with those funds, with those unrestricted funds, we're able to house more individuals, put people into shelters. And, that was the intention back then, so people can die with dignity. And we still continue that mission today, but with just a lot more services. And we're going to kind of, dive deeper into how much units we've done over the course of 5 years and what that looks like. We do have braided funding. We utilize 2 federal grants, Ryan White and HOPWA. We love to intertwine these two grants because they have specific outcomes. And I always like to say, you got to know your grant, you got to know your contracts. When you really dig into your contracts and know the policies, the protocols, you can really start to tailor and finesse your programs to make it your own. We serve 3 counties, Nye, Mojave, and also a little bit of Arizona. And we also serve, there's like 5 other HOPWA funded agencies and 17 other subrecipients of the Ryan White Continuum. With that being said, we are the payer of last resort. We and another organization are the ones to cover all of the other organizations' EFA costs, emergency financial assistance costs that they cannot afford. We mostly assist with the financial portions. If we have time and capacity, we will assist with the searching for the apartment or the or house. We have low overhead, and when I say low overhead, it's only pretty much 3 people that run the organization. Myself, which kind of provides a lot of oversight. I do a lot of health education, which is really, really imperative to someone who is living with HIV and being housed within our organization. And then we have another colleague of mine, Joyce, who does all the referrals that comes to the office. And then my executive director. We just recently hired another person, but we are a very, very small team assisting 3 counties and a lot of organizations. But again, the low overhead creates more opportunities for us to assist more households and more families. So I'm always working. Every time you see me, there's always a laptop happening. I'm always like just getting stuff done. So, which is great. We love the work that we do. Payouts are usually received within a week of service. Depending on if we receive all the required documentation, we're able to pay that out within a week. We do take precedence over disconnection fees and evictions just because those are very time sensitive. We have alternative ways to pay for assistance. So, if a client does not take third-party checks, we can do a cashier's check. If the client needs to pay through their online portal, we have credit cards to do that, or we have means to do that. So we have other ways to pay for the assistance. Even if the client cannot come in, we can pay for the assistance as well remotely too. But as Joanna mentioned, it is a collaborative effort between the case management team and our staff. We have to really understand, really get the client's, housing plan and case plan to understand what is happening at this time of need and what is the long-term sustainability. And that's kind of what we look at when we look at these referrals moving back and forth. And then so moving forward to the next one. So our housing efforts and solutions, as a organization, we really have to look at, since we are a very small organization, we have to, number one, look at our capacity. How much capacity do we have to assist this amount of households and individuals? And so we really focus on housing stability and permanent housing placement. We utilize the braided funding between Ryan White and HOPWA, and I love to really utilize this model because, there are certain situations that may happen from the client's housing. For instance, let's say, so if you look at the 3rd bullet point, you'll see EFA, Emergency Financial Assistance. That's with the Ryan White program. And then you see another bolded point, which is STRUMU, which is a short-term rent, mortgage, and utility assistance. These are 2 different programs. EFA is with Ryan White, STRUMU is with HOPWA. What I love about these 2 programs and how we braid these, it's depending on the client situation. Say if the client, because EFA, there's a certain, obviously everybody has grant years. This is from March to February. Say if there was, a rental arrear that occurred before March, this grant would not cover it. It has to be within the grant year. What's great about HOPWA is that that's from July to June. So we really can get an opportunity to work in the back end with another grant to work with those rental arrears or those utility arrears and really assist. And I'll take it a step forward. I'll take it a step further. So even with EFA is only for the individual. where HOPWA is for the household. EFA has a max of 3,000. HOPWA has a max of 21 weeks. So really understanding your contracts and knowing what to do with the scenario that you have at hand with the client's housing, with a housing plan, you really can kind of really find out and work as a team to understand how can we really assist these clients in the best way possible without, number one, jeopardizing our funding, but also knowing how to work our grant properly. We also have some other support services such as health education. I think this is really, really important because the client needs to be educated upon, what their HIV and AIDS diagnosis looks like and how we can get them undetectable. We've always had EFA and HER all the time and permanent housing placement, which is PHP. And PHP is basically to cover moving expenses to the client, to the apartment or house they've been approved for. We've always had those three, EFA, HER, and PHP. We just added STRUMU during COVID, as well as project-based rental assistance, which is our subsidized housing program, and transitional housing program. So all those last three things got updated and got added to our housing portfolio when COVID happened. Some support services that we do offer: health education, legal documentation, as mentioned before, employment assistance and training, and transportation. Transportation is mostly given to our clients that are enrolled in our housing program. And you'll see in the next couple of slides why that is. And then linking and re-engaging clients into care. This is something that our grant area is really trying to really get a strong hold of, is really trying to make sure clients are engaged into care. So the history of Golden Rainbow, or basically our housing program per se, is, we started off as a transitional housing program. We thought that, a year would be sufficient for them to get on their feet and to, be out in the workforce and to be stably housed. And that was not the case. When we first got started, it really wasn't the case. And it wasn't, we really had to go back and, do some quality improvement of what this looks like and what the need is at this current moment. So if you look at this table, you can kind of see from 2019, and this is before my time, we had some units a long time ago as well, but with our city and county, they decided to knock those down and basically build and widen the Project Neon, which is the I-15 for our biggest freeway. So they took those developments down and created a freeway instead. So we had a lot of units that were already gone. So we had to start new. So 2019, we had one unit called the Burkott. This was really, really far east of us, Sunrise Mountain. It was very, very far, but it was a great 3-bedroom condo. From there, we kept that intention. And before that, before 2019, we've had units, but they were not in a federally housed program. We were just collecting rents to collect rents. We were not getting a subsidy from them. So since 2019 and with just the movement of our organization and our team, we wanted to receive those subsidies and start to receive program income. And so with every property that we acquired, we've put onto this federal program. So you can see up until 2020, we only had basically one unit. From 2021, we got a very generous donation for a fourplex, a four apartment family unit, which was great. So it had 2 1-bedrooms, a 3-bedroom, and a 2-bedroom. We fulfilled those within that year. And then we got another lovely donation for 8 1-bedroom units. And as you can see, in 2022 and 2023, we have 2 properties, 11th Street and Held Road. You see that there are 12 units combined in total, 8 1-bedroom units, 4 units. The issue is that while we were inherited this 8 1-bedroom complex, we inherited tenants. And with these tenants, they are very elderly. They've been living in these units for about 15 plus years, and they're only paying about $650 a month. And so, we have to look at it from an organization standpoint of, what are we doing as an organization to assist affordable housing, and would we kick these people out? So we're coming up with some strategic ways how to transition them out into another apartment or another area where it's going to be just as feasible for them to afford their rents. So Golden Rainbow doesn't want bad press, so we're going to keep it in their units, and we're going to work with them as best as possible. But ultimately, the goal is for all 12 units to be all 12 units and 2 properties to be assisted with all Golden Rainbow house clients. That's pretty much the intention. So data and statistics, when we're looking at this, data in general, it definitely brings a lot. We have about 3.1 residents here in Las Vegas. We have about 6,500 who are unhoused at the moment. When we're talking about people living with HIV, we have about 11,000 people living with HIV here in Las Vegas, and about 700 of those are unhoused. So when you're looking at a broader picture, we have some work to do. And again, we just have to start small. We have to start small and just kind of look and just kind of, just keep that momentum going because it is moving the needle more ways than what we thought. So when you're looking at just our data over the years, just the units, I wanted to put units as far as in just amount of money that was put into the program, because I think units are a little bit more, you can definitely, it's more visual and has more impact than just numbers. So over the 5 years, starting from 2019 to 2023, you can see the first 3 columns: EFA, which is Emergency Financial Assistance; PHP, which is Permanent Housing Placement; and SUP, Supportive Services. We've had all of these for quite some time. And you can see that the 4th line was transportation. Ooh, now this is kind of really understanding your grant. You can see that over the course on 2020, you can see we did about 777 bus passes. These are monthly bus passes for the community. When we were looking at, we got a couple conversations from our grant, and our grant was like, hey, this is HOPWA was like, this is a housing opportunity. We really should be marrying more housing services instead of bus passes, as we're not a transportation company. Very, very true. I didn't, being new and new and green to this, we really had to look back and just kind of see the scope. When COVID happened, we were the only organization that was still open behind closed doors, locked closed doors at that, and paying out checks and receiving all of these eviction notices and rental assistance applications. So you can see, and we had the highest amount of EFA for only 2 people working in the office of 337. Not including the CEFA, which was the COVID Emergency Financial Assistance funds that we received as well between both grants. So with that being said, going to 2021, we really decreased the amount of EFA, but made up for it in the COVID funds that we received. So about 221 referrals was received throughout that year, not including the permanent housing placement, supportive services, and transportation. 2022, we really and then our transitional housing, which is our hotel motel assistance. We have to have somebody placed within 60 days at permanent housing placement at the time they enter the hotel from the time that they leave. So it's a lot. So we really don't utilize this grant as much because it's only 2 people in the office and working and doing these programs. 2022 to 2023, you can kind of see, we're really averaging our EFA scope, but increasing in our PHP, our move-in assistance. A lot of clients were looking at, their expenses. It was getting a little too costly to live in their apartments that were being, that they either lost income or they got a new job that they can't afford. So we were covering move-in expenses on the rise. Supportive services have kind of really dwindled down because there are a lot of other organizations providing the service as well. Transportation, we only utilize these only for our clients within our housing program. So you can see that the number has dropped significantly, but has increased just because we have people in our program and they need these monthly bus passes. And then the COVID funds have really exited out during 2022 because that was the end of that grant year. But we have added, we've been seeing a lot more transitional housing, as you can see, 2, 4, and 6 moving up throughout the years. Again, we did 6 this year or last year just because we had the capacity. And then we have our housing program, which I oversee. So we have 4 enrolled, and now we have 8 from last year. So you can kind of see the units over the years, just how Golden Rainbow, even as a small organization with a small team, can make a big impact within the community. So partnerships matter, just like as Joanna mentioned. I met Joanna at a housing mixer at a wine bar. And, I was like, let me just check this out because, I need to start to expand my reach and start to understand more about housing and the effects and how we can be how I can better my organization and our community. And that's how this all got started, to be honest. It's really, really important, and I mean it's super important to not only share partnerships with your traditional community, your traditional agencies and institutions, but also non-traditional. You don't know who's in the room, and it's extremely important to explain your mission, explain your voice, and really try to reach, because not only that, you can start to be a resource for their organization to provide additional support or services, visibility for your organization, a direct point of contact, which is extremely important because sometimes you don't know who to contact at that agency, but also raise awareness of HIV and STI and housing, which I think that's a very lost, that's a lost messaging that a lot of people don't get, is the HIV and the up-to-date HIV and STI data and statistics, which everybody should know about that. But yeah, it's super important to start these partnerships because they do matter. So here are some of the takeaways from this presentation. As I mentioned, it's not going to be as in-depth, but if you like, we can definitely go offline and talk a little bit more. Start small. You always got to start small. You never know where your programs can end up. I think, Joanna, we're actually mimicking the same language from her presentation. There is no one size fits all for a housing program. There's a lot of ups and downs, hoops and hurdles. Try new strategies and definitely celebrate your successes. But these are the top 4 that I put there. Set the tone, create policies, culture, your scope of work, contracts and staff capacity, because you got to set that before anything else happens after that. From there, always explore and improve your programming and your services. There's always room for improvement. There's always room for improvement. It's always best to keep that practice going. Timely, as I mentioned before, when I was talking about my hairdressing, you got to be on time. You got to be timely of being prompt with responding to referrals, partnerships, and inquiries, and being available. I know it's hard to be available all the time, but if we want to move the needle forward, we got to be available to receive that information and to help. And then open dialogue, have consistent team planning and meetings, explaining the why. I think it's extremely important to explain and give anybody the why. It makes no sense to hold all of these policies and procedures behind closed doors like it's a secret book, when it's pretty much it's online. It's it's federally, it's there. They can look it up, so add in those excerpts of those policies, put in your own language, and just it creates some transparency, because we do have these uncomfortable conversations with clients of why we can't pay you for your rent, why we can't do this, and they need to know the reason why. I think that's very, very important. But last but not least, here are some resources for you guys to take away. On the far left, I have just the names of the resources, and on the right are the web links attached to them. So you have the National Native HIV Network that we are a part of and that this webinar is hosting. Thank you. We have the HUD Exchange and HUD, which is where you'll get all of your housing questions and also technical assistance. We have the Ryan White program, which everybody's kind of familiar with. Some data, which would be AHEAD, hiv.gov, and aidsview.org. Golden Rainbow, which is us. We are a resource for anyone living with HIV in the state of Nevada. We are a very, very heavy resource, specifically in these counties. And the Nevada Housing Coalition. I think it's really, again, partnerships matter. And ever since, really talking with her and, talking with Joanna and just kind of really creating this partnership has created more opportunities for me to do more work, expand our work, but also to assist the community as a whole. So I want to guys thank you so much. Here's my contact information. I believe Donna will probably put my information in the chat, but I thank you all for listening. And I hope that, we really touched on some really good talking points about HIV and housing. Thank you.
Thank you, Darnell. Oh my gosh, that was a lot of great information from both you and Joanna. I love all the advocacy work that you both are doing for our communities, and especially for the networking that you're doing with tribal communities in Nevada and the surrounding states. I'm sure folks will take away some of the resources and reach out to assist with housing for everyone. Um, I I just wanted to point out that you both mentioned that housing is healthcare, and just from listening to your presentations, I think it's very important for this kind of information to reach all tribal communities. Thank you for the resources that you provided. Let's see. I had pointed something else too. Yeah, Darnell, you pointed out the eligibility criteria for Ryan White versus HOPWA. I did not know that, so that was good information for me. Um, for sure, like people will be reaching out to us regarding, any kind of housing resources. So I'll share your contact info with them. Let's see, there was another thing that I wanted to point out. So with HOPWA, and well, I have a question. I should start before we move any further. So I'm sure like a lot of people are faced with discrimination for housing. Do you have any direct contact info for individuals who are being discriminated against because of their health status or because of their race or anything like that? Either like in the state of Nevada or nationally. I think that's
Yeah, I have one. Silver State Fair Housing Council is one of them. They are really great about acknowledging any type of inequities within the housing. That could be with stigma, that could be with discrimination, it could be with everything. They even go even like to even just shop in general, to shop around, to kind of, monitor what's happening in the community. The only downfall is that you'll have to really give your case multiple times so they understand the situation, but they are a very great resource. We hand this pamphlet to every client that enters our program so they know that they feel supported.
okay, cool.
That's great. We also, in Nevada, we have free legal services through Nevada Legal Aid and the Southern Nevada Legal Aid Center. We have two, and I know in a lot of states that I've worked in social services, there are similar organizations that offer tenants' rights and free legal aid to tenants. So I'd say you can, wherever you're located, there might be a free legal services that focuses on tenants' rights that you can turn to.
Awesome, thank you. I see that Darnell dropped it. Silver State Fair Housing Council. Okay, that's in the chat. Okay, we have Savannah Jean also put in the chat. Native American Youth and Family Center also has housing developments. So the link is there.
Yeah, I almost added them to my slide. Actually, I learned about them at a tribal housing conference last year, the NIAC conference, and I had 3 examples, and then I was like, calm down, Joanna.
The more the merrier, Joanna.
Yeah.
Yeah.
But
Yeah.
that's a new project, and I loved their presentation at that when I saw it at that conference.
Cool. Okay, so we will open the floor for questions. If any of our attendees have any questions, drop your questions in the chat. And again, this webinar will be made available on our YouTube channel and also at our National Native HIV Network website. We don't have any questions. So I'll also say you can email me directly if you have any questions, or email Joanna or Darnell. Let me put Darnell's email in the chat.
Yeah, I'm happy to chat with anyone and meet with anyone. As Darnell said, I agree with all of his points on those later slides around being responsive and being available. I think it's really important that we work together, even across sectors, even when it kind of seems like it doesn't align perfectly. at first. And that's kind of where a lot of the magic happens, where you learn what other folks are doing and you can apply it to your own work.
Agreed.
Okay. Yeah, the data you presented, Darnell, it's alarming. I mean, 700 people unhoused in Vegas. Wow. I can't imagine other states.
Yeah.
All right. Well, this concludes our webinar for today. Thank you again for joining us. Again, please visit our National Native HIV Network for upcoming webinars and also other resource information that we have available. You can become a member there as well, and you'll receive our monthly newsletter with lots of valuable information for anyone that's working directly with tribal communities. I want to thank Darnell and Joanna again for this presentation. You guys are just fabulous, and I'm so happy I got to meet you, Joanna and
Me too.
Darnell. Yeah, so we'll see you both around.
Thank you so much. I was really happy to be here. Thank you so much.
Appreciate it.